My name is Beatriz Vides. I am a registered nurse. I have been at UC Irvine since 1999 when I started with UCI MIND as an undergraduate student. Then I was hired full-time in 2002 to join the clinical trials team as a recruitment coordinator. My current role with UCI MIND is to help lead the clinical trials team and oversee the operations of our many clinical trials at UCI. I still get to do a little bit of patient care, but not as much, but I still enjoy it every day. I became involved with UCI MIND as an undergraduate student because I was seeking employment. However, there was something about the name of the group that I found quite interesting. As an undergraduate, UCI MIND was known as the UCI Institute for Brain Aging and Dementia. And at that time, as an undergrad, I knew I wanted to go into medicine. And I really was interested in learning more about what this unique group did on campus. So I looked into it, got hired, and here we are. When I first joined the team at UCI, I really enjoyed observing the clinicians and the type of relationship that they developed with the participants, the research participants. They formed more than just a patient-clinician relationship. They almost became like friends or extended family. So that's one of the things that as an employee or a staff member, I wanted to develop with our participants. So I find that the ability to develop these relationships with families, with participants over a long period of time is what I find one of the most rewarding. One of the most memorable experiences working with UCI MIND was getting to help a Spanish-speaking family get an assessment for a family member that was severely demented. The family had gone to multiple hospitals, multiple doctor's offices trying to find an answer about what was wrong with their loved one, and they just could not get an answer. And I was able to get an assessment while brief here at UCI for the family, and was able to help the family establish a diagnosis, get them some resources to help care for their loved one, and ultimately they helped us significantly by providing us with brain donation and also a sample of blood, which was really beneficial to our program because we don't get a lot of ethnic minority participants in our program. So just being able to help a family that otherwise wouldn't get the help they were looking for, I found extremely rewarding. The thing I enjoy most about my job is getting to know the participants that involve themselves in research for many years. We become like long-term friends. I get to know about their families, their trips, their background, their lives, and they too find out a little bit about me. And I think having that relationship makes this job very pleasurable. It definitely always look forward to coming in.